Hello, this is a presentation on diabetes in relation to oral health, and it is presented by Kristen Jenkins. Let's get started. The first slide is all about diabetes and how a person gets diagnosed with diabetes. There are two different tests that someone might take to measure the blood glucose levels. Some signs and symptoms of diabetes include urinating often, feeling very thirsty and hungry, extreme fatigue, and blurry vision. And there are two major types of diabetics, type 1 and type 2. Type 1 is where a person's pancreas does not produce insulin. This can happen when the body's immune system attacks and destroys the insulin-producing cells found in the pancreas. Type 1 is insulin dependent. Type 2 is the most common type of diabetes. People with this type do not make enough insulin, or the insulin that is produced cannot be used properly. Type 2 can be managed through diet, exercise, and self-monitoring blood glucose. These are the diabetic oral complications and risks. The blood glucose levels affect the complications in a diabetic. They can cause dry mouth, tooth decay, gum disease, oral infections, and the picture shown is a picture of a diabetic with gum disease, the top picture. You can see the gums are very inflamed and very red. Diabetics are more at risk for gum disease, such as a periodontal disease, because their bodies cannot fight off infections or bacteria, as well as a person without diabetes. Ways to relieve or help prevent complications. Controlling blood glucose levels helps relieve and prevent dry mouth. It can prevent gum disease and also oral infections. Checkups are recommended every 6 months for healthy patients. An at-risk patient is 3 months. And of course, maintaining good oral hygiene can prevent tooth decay and gum disease. Diabetes in the endocrine system. It's very important to the body. Maintains homeostasis through a balance of glands and hormones. These glands produce different types of hormones that start a specific response in other cells, tissues, and organs all throughout the body. There is pictured a picture of the endocrine system. The importance of glands in diabetics. The pituitary gland is very small and it's located in the brain. It produces most of the important hormones that the body manufactures. For diabetics, one of the symptoms is having excessive thirst, meaning the gland is not working hard enough to keep up with the demand of blood glucose. The pineal gland is also an important gland to pay attention to. This gland is responsible for secreting melatonin, a hormone that helps regulate sleep. This has to do with maintaining a healthy weight, which is very important in diabetics, especially type 2. And finally, the pancreas. It's actually not an endocrine gland, but it is part of the body's hormone secreting system. It's responsible for producing insulin, and they both help maintain sugar levels in the bloodstream and give the body energy. And that's it. Thanks for listening and watching.